Hey everybody, welcome to this week's Doc Talk. My name is Dr. Aaron Frach. Today's guest, we have Dr. Taylor Koloc. We're going to have some hard-hitting questions. Are you ready?
Born ready.
Do you want like hard or easy question first?
Easy.
Okay, we'll go easy. Let's see. Let's go with what is your spirit animal
Dog.
and why?
Dog, because I'm obsessed with dogs.
Okay.
I'm pretty sure I've convinced many patients to try and bring their dogs into the office just so I can pet them.
Not like today where you already did that.
Oh yeah,
with a stranger.
There was a person outside with their dog, and I went outside and asked to pet their dog. So
It's good.
Mhm.
Let's go with what's your favorite patient success story?
let's see. I have a couple. I'd say most recently I've had a patient that's been suffering from back problems forever for a long amount of time, and once we kind of focused a lot on their rehab program and actually doing and being more consistent with the exercises, their nerve pain went away. A lot of like their electrical symptoms went away. They were able to walk, start exercising, going back to the gym. So I'd say that's probably my best success story because they hadn't had success in the past.
It's pretty awesome to see that, like seeing that recovery, because again, like they get to a point where they don't think it can ever come back or like ever happen again. So they kind of live in this like doubt-filled world. So
Yes.
it's kind of cool to see that like light come back, and all of a sudden like you start asking about symptom stuff, and it's like they have to think about it, and they're like, oh wait, and it's awesome. So it's really cool to see that.
Yeah.
So if your spine could talk, what do you think it would say to you after a long day?
Stretch.
Sure.
The things I tell my patients to do that I'm bad at myself is stretch.
All right.
Yeah.
If you weren't a chiropractor, what other profession do you think you'd be drawn to, and why?
Probably like an orthopedic surgeon.
Okay.
Just so I could be a bone cracker, but in like a different life, or like putting them back together.
You with like medical hardware tools would be scary.
That would be fun though.
Like just yeah.
What'd you do? Yeah,
I've seen
put
you
a
do
bone back
soft
in
tissue
place.
work with that smile on your face. I can only imagine like a knee surgery with a hammer. So
Exactly.
all right, so a lot of people probably don't know, but Dr. Taylor like loves dad jokes. So I have the question of like, let's hear your best dad joke.
All right, so good, solid, clean dad joke, or what do you call a deer with no eyes?
What?
No idea.
Any follow up?
What do you call a deer with no eyes or no legs?
I don't know.
Still no idea.
Oh my god. Okay, we're gonna have to just cut. That's terrible. No. All right, let's get into another one here. So let's go. What's your favorite way to de-stress after a busy day of adjustments?
Video games for sure.
Okay, like which ones?
Fortnite.
All right.
I play way too much Fortnite.
That's a big thing though. Like everyone like loves Fortnite, and obviously it's got like all of its different theme stuff too. So
yeah, actually my friends from my doctor program and we all get on, and then we play Fortnite together and talk about like if we had a weird case for the day, or talk about like different things.
That's fun. I mean, it's a good way to like people still connect, because again, like a lot of times you don't have that schedule, but everyone can kind of like pop online and play and still like communicate and still do something. So it's really good. Let's see. Let's jump in here. What piece of advice would you give to your younger self?
Care less about possibly failing.
Okay.
Failure is good, and that's how you learn.
Right.
And that's how you grow as a person. You don't need to win everything all the time.
I think I was just seeing something the other day, like failure is part of the process. It was Patino, and he talks about failure being fertilizer for growth. Like you have to fail to learn. And if we're afraid to fail, we never really try or never really apply ourselves. So it's actually, it's really good. So I think that's a really good point of advice. Let's see what else we got here. What's the most surprising or unexpected thing you've learned about the human body since starting your career?
Like, do you know it's only like 70% accurate about what we learn in the human body and like the anatomy books? It's only like 70% accurate. There's so many different people that have different like orientations of like where their muscles actually connect, or ligaments, like where it connects on their bone. It'll be a different place. Some people will like be missing a muscle entirely and never have an issue. Yeah, it's just crazy that it's you expect this one thing and you're like, actually, it's only like 70% accurate. Right. A lot of people have different variations.
Huh. Which would probably be why they call it practicing. Because you never know what you're going to run into.
Yeah.
So, okay. So I got one more. And this is always another one. So Dr. Taylor is also a karaoke rock star. What is your best karaoke song? Like, what's your go-to?
Always Respect by Aretha Franklin. I know all the words, so I don't have to look at the screen for when it sings.
All right. Sing it.
I'll sing the chorus, but more of like the R-E-S-P-C-T, find out what it means to me.
See, it's great. Now we got to just figure out where she's going to be so you can hear all of it. Our go-to is always like Top Gun. If you've ever seen the original, is the "Never Close Your Eyes Anymore." So now think of just a group of college guys singing that. It's as embarrassing as it sounds. So
you would think it would be the do or a Great Balls of Fire.
Yeah, you could have that one too. Obviously, that's a little more modern. Otherwise, you just go like straight boy band, right? Go like NSYNC, Bye Bye Bye.
You are my fire.
I think we're gonna end on that note. Thanks again for listening to this week's Doc Talk.
Thanks, guys. It was good harmony.
That was.